Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
Alright, Joycelyn, tell me what's going on with your knees and your hip.
I guess it's been going on so long, it just seems normal. But,
How long?
How
many years on average?
10. Well, even when I got my hip surgery, nothing really came back to normal. So.
Okay, so you had what kind of surgery for your hip?
Full hip replacement.
Total hip replacement for your right hip. Okay. Okay.
Yeah.
So what kind of symptoms you currently have now?
I have no rotation in my right leg. I can't like lift it. It hurts. I try to.
How much pain from 0 to 10?
Well, you know, you try to avoid pain, so I'm not going to lift it to cause myself pain.
At worst, how much if we push it?
I'd say about
That's
8.
very tight. 8. Okay. Sharp, dull, aching? What kind of pain?
It's like
muscle cramping and your hip?
Here.
Yep.
Yeah.
And you said like 10 years, this cramping, like pain you experienced there?
Yeah, no, this never really got better with the surgery. But then I thought I was compensating for it, and that's when my good leg, I thought, started to give me trouble.
Okay.
Yeah, and my left knee especially, I couldn't, it stopped being able to straighten it. I couldn't straighten it.
You couldn't straighten it? Okay.
It really, really hurt.
And the left knee for 10 years too, or how long?
I'd say that maybe 5 years.
5 years, so the right side 10 years of issues and 5 years. So what's difficult for you to do because of this issue?
Stairs.
Stairs climbing, okay.
At times I have to decline the stairs backwards.
Oh wow.
Even now I walk up stairs one at a time.
You do one step at a time to compensate.
Always holding onto the rail.
What about walking, getting to the floor? Like you said, you have a granddaughter.
Yes. And getting down on the floor is difficult. I have to find things to brace myself to get down, find things to brace myself to get up. I cannot squat.
You cannot squat. It's painful. Okay, so we're gonna do a couple of those motion. And we'll do the treatment afterward, and we'll try it again to see how your body responds to the treatment. So one of the motion is just flexing like this. Okay, the other one is squatting. So let's try to squat.
Okay.
Like, don't push the pain, okay? And tell me how much pain with that.
That's painful right now.
0 to 10, don't push it.
5.
Okay, so let's go. Sorry. Okay, and stop when you feel the pain. Here, it's a 20. Can you see this? Like 26. 26. She put her leg down because the pain, but it's 26 right here.
Okay.
That's the okay. All right. So all right. So bend your knee.
Can you judge without holding?
Okay, so we'll measure this too. Okay, so this is 90 degrees. Remember the numbers, okay? This question will be on the test. I'm gonna ask you 92 or something like that. Okay, straight your knee. Let's do the other knee, okay? Bend your knee. Okay. So you can tell the difference. This is like 105. This is 105, the other one is 92, and that was 25. Remember those numbers. Okay, so hip flexion should be like 110 or something like that. So we're gonna work on that. So the incision in the for the hip, right there. Okay. I'm not gonna expose it, but is it okay to work on it? Yeah. Okay. All right. So. Okay. So that limitation for the last 10 years, yeah? Yeah. So,
Because when I came out of the surgery, this leg was very weak and turned in.
turned in.
And then I
Okay.
did physical therapy.
Okay. So, oh yeah, what kind of treatments you had before? Yeah, I forgot to ask you.
I forget what the physical therapy was so long
So you
ago.
had physical therapy. What else? Is it you had mobilization before, like chiropractor?
I tried different things, but
What else?
nothing really helped.
Okay.
Massage.
Massage.
Therapy, really.
So you had chiropractor, PT, physical therapy, massage, and you said for mobilization. Who did that? Chiropractor or PT?
It was physical therapy, yeah.
Physical therapy. Okay.
It was Pinnacle in New Jersey was the last time.
New Jersey?
Yeah.
Yeah, I used to live in New Jersey. That's neat. So you will tell me the difference. This is called ASTR treatment.
Okay.
So you will tell me the difference because you had a physical therapy before. If you can tell any difference from the treatment when using those instruments.
I usually do the other year.
Okay. It's gonna feel cold, okay?
Okay.
It just helps me sweat.
Those bump here,
Yeah.
that's a scar tissue. So we get the scar tissue from accident, trauma, poor posture, poor body mechanic. So our muscle should act like a rubber band when it's contracted and relaxed. It does this. From like limping, probably from your history of limping, you start to have a micro tear in the muscle. And your body has to build the scar tissue to heal itself. If our body does not build the scar tissue, it's permanent tear. So probably because of your history, you did a lot of limping for a long time. So a lot of micro tear. Instead of your muscle stretching like this, start to have knot in the muscle. So when your muscle stretch,
Yeah, because when you're
it does not go far. So when you try to do this range of motion, it's limited, you know. And with surgery, you had a scar tissue from the surgery. If you don't have a scar tissue, it will never heal. We need the scar tissue. The problem is, lift your legs up. If we have too much of scar tissue, that's in the way. It's not, scar tissue is something good actually,
Right.
but too much is not
No.
good. Yeah. So,
Makes sense.
and you feel those bump here.
Oh, yeah.
Yeah. So that's why you have trouble probably from flexing your knee.
And before I, agreed to do surgery,
Mm-hmm.
this right leg was literally shorter.
Uh-huh. Sorry, sir. Make
That's
sure it's
okay.
not painful, okay?
Okay.
Okay.
Okay, it's
Alright.
all.
So let's actually lie on your side, this side.
Okay.
Keep going. Yeah. Like that. Did you do 30? Yeah.
Next time, bring shorts, okay?
This one.
So this way we can work. Is that painful what I'm doing? Sorry. Make sure it's not painful, okay?
Okay.
And don't kick me here, okay?
Okay. It's all so painful.
Sorry, sir. So that's painful too here? Yeah?
Yeah, but less.
Okay.
Really a lot right there.
Yeah. A lot there. Is it because of the position? Bend your knee.
No,
your
it's
knee?
just to the touch.
Bend your knee. So it's a sensitive to touch, yeah?
Yes.
Okay. What about now? Here. Painful? It's okay.
Still pain, but
Oh man, you get a lot of scar tissue here. Okay, so you're not tolerating that. You're gonna do something else, okay? So so let me. So you said it's right in here where you had the surgery.
Yeah.
Okay, make sure it's not painful what I'm doing, okay?
okay.
I'm gonna work on breaking some of the scar tissue here. Is it painful?
No.
Feel this bump here?
Yeah.
Okay. This is the side she had the total hip replacement. So we're working on the scar tissue there. She had it 10 years ago, you said?
2002.
2002.
So
We are in
almost-
2018.
Yeah.
Yeah.
So 16 years.
Wow, 16 years.
Yeah.
Wow. That's good, yeah. Is it painful here? You feel the scar tissue
I
here?
feel it's not the same pain I was feeling in my
Yeah. Okay. You got some work to do here. You have a lot of scar tissue here. Okay. Sorry. Okay, so I gonna.
It's like all of a sudden those areas like come alive, like whoa.
Yeah. See? Good thing it's still alive, you know. Let me know if that's too much, okay? So for your knee, when you're bending, it was all in your quads, the pain, or where you were feeling the pain?
My knee, mostly my knee.
Just the knee joint, yeah?
Yeah.
Mm-hmm. And you had shots and you had before. Okay. Let me know if that's too much, okay?
Okay.
Okay. Okay. Sorry. Okay.
Yeah.
Don't scream, we're recording. No, that's okay. We'll just make sure it's not painful, okay? Yeah. Sorry. You definitely have a lot of inflammation. So, let me place everything here. Okay, let's lie on your back. Okay.
And I'll tell you something recently. I was able to lie on my stomach. I haven't been able to lie on my stomach for.
Oh wow! I don't want you to lie on your stomach. It's not good for your neck.
Okay.
Yeah, you know, just sleep on your side or your back, but
Okay.
not in the stomach.
Okay.
Okay. Okay. Let's try to take the range of motions
Do you
again.
want to do
Okay.
this
See
side
how
we
you
can
do
do
it.
balance, so we can start to do steps.
Okay, so let's take the knee, bend your knee. So this was 92. Let's see how far we can go now. Can you see that? It's 105, the same like the other side. 105. Okay, that's good. So 92 to 105, 13 degrees. Is that correct? Okay, so let's the straight leg raise. That was 25. Let's see how far.
Can I bend this?
Sure, yeah.
It doesn't want to go anywhere.
Okay, so let's where do you feel it? Right in here. Okay. Let me know if that's too much. I'm not gonna use my hand. I'm gonna use instrument. Is that okay? Okay.
Let's bring feet close together.
So bend your knees.
Like this.
Oh, that's another thing. I have to get in and out of the car. I have to lift my.
Well, if your decreased range of relax.
Okay.
If that's related to muscle weaknesses, we just need to strengthen. Whatever we do here, you're not gonna gain range of motion. We just need to strengthen it. So I will know today if your limitation because the soft tissue or just weaknesses, depending on how you're doing with that. Is that painful? What I'm doing? Because you have a lot of time. So how long you cannot do straight leg raise?
Ever since my surgery.
16 years? Okay, so 16 years, let's see. Well, I'm sure there's a lot of weaknesses here, but let me do a couple of things and see if we... That's a smile, okay? That's not a pain. Let me know if that's too much, okay?
It's okay.
Okay. Too much or it's okay?
It's okay.
Okay. So 16 years you have problem to do straight leg raise. It was 25 degrees. We'll see how we're doing this. Too much or it's okay?
It's okay.
Okay. Alright. So
Yeah.
So let's
I think I do when I open my eyes.
Of
course, yes.
What do you have to look in
I feel like walking. Okay, so it's just steps on it. Okay. This way? Yeah. Just
Okay, let's do the straight leg raise again.
let's do.
Whoa.
That is
able to
wow.
do that.
There you go.
I'm never going to be able to do that.
That is 53. You see that? 53.
Yeah. You can do it better.
Magic. Okay. 53. So 16 years you could not do this? Okay.
It just like felt like a piece of dead weight.
Yeah, and it was 25 degrees, now it's 53.
And it really, really hurt.
Yeah, let's try it again, okay? This is the second visit for Joycelyn. So we worked on it in the first visit, and now we're gonna measure the hip flexion after working on the total hip scar tissue. So I had Linda worked on the scar. There was a scar on the front and the back, and the range of motion originally was 25 degrees, the first treatment. So now we're gonna check how much she can lift her legs up.
Okay.
And you tell me if you feel any pain, okay?
Okay.
So start.
I start feeling more pain, but I can't believe
Okay,
this.
so
I
look at this, it's
cannot
100 degrees.
believe it.
100 degrees, this number.
It's a little tight here,
A
but
little
it's
tight,
like
but it was
nothing.
25 originally.
I couldn't.
This is the second
I could
treatment.
Never, I couldn't even lift it. I couldn't even bend it like that.
How much pain the first treatment? We're saying it was like 8 or something like that?
Yes, yes.
How you feel now after just 2 treatments with that range of
am
motion?
amazed.
Yeah.
No, let me do it again.
Just do it, get the whole
Because
shot.
I can't believe this. I cannot believe it.
Yeah.
Oh,
All right. So what do you think about the ASTR treatment?
I think it's like amazing.
Yeah. Thank you so much. Yeah.
Overwhelmed.
Yeah. I'm glad you're doing better.
Yeah, me too. Thank you.
Thank you.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.